Professor Brigada, it's an honour for you to join us here today.
Pleasure.
Very briefly, how do you see the clinical utility of cardiac MR for the electrophysiologist?
It is a tremendous use, and we have learned that over the last years. So we have been progressing a lot in electrophysiology in terms of identifying the different substrates. But then when we wanted to attack these substrates and to treat them effectively, we realized that we need more information, that the electricity itself, which is our field of work, was not enough to understand the substrate and the mechanisms of the different arrhythmias. So for that, CT scan at first and now MRI, CRM is absolutely necessary for us, because it shows us not only the anatomy, but it shows the tissue characteristics, and it helps us identifying the channels in the heart, electrical channels in the heart, and the targets for our ablation. So for us, it's absolutely now a cornerstone for us to have good information on MRIs, collaborate very, very closely with the imaging people to have the good imaging, and thinking on how to help the patient is not only making the diagnosis, but now the thinking is, if I have this information, how can this help me treating the patient? And so this is the big challenge, or big differences on what we had before. Before we wanted the imaging people to give us a diagnosis. Now we don't want the diagnosis. We want is, how can I best treat my patient?
Wonderful. Thank you very much.
Thank you very much. Thank you.
So I'll let you get